The aim of this instructional video is to help both students and practitioners gain a systematic understanding of the theory and treatment of dermatological disorders with acupuncture. In addition to strengthening fundamental acupuncture theory, point location, and needling techniques for the treatment of dermatological diseases, this video contains information that aims to help practitioners understand the laws of pattern differentiation as well as prevention of common dermatological problems. We will now begin our introduction to the use of acupuncture for the treatment of many commonly seen dermatological problems. Snake strand sore. Snake strand sore is an acute herpetic skin disorder that manifests with clustered eruptions of vesicles on the skin. Most often, these blisters appear on one side of the body. They usually wrap around the trunk and are accompanied by a painful burning sensation. In biomedicine, snake strand sore is referred to as herpes zoster. In Chinese medicine, it is also called girdling fire cinnabar, fire band sores, snake cinnabar, or spider sores. Section 1. Disease causes and pathomechanisms. Snake strand sore occurs due to the internal damage caused by emotional and mental immoderation, as well as binding depression of the liver T. Long-standing internal damage and stagnation can transform into fire and spread outward to the skin. Snake strand sore most commonly manifests on the trunk. If the damp evil seeps downward, it may attack the genital region or the legs. In elderly or deficient patients, there is often blood deficiency with liver fire rising and damp heat toxins have accumulated in the body. This leads to the stagnation of T, congealing of blood, and obstruction of the channels and collaterals, which in turn causes intense pain and a protracted illness. In short, damp heat fire toxin is the primary factor in the initial stages of snake strand sore, while deficiency of right T and blood stasis, along with damp evil, are the primary factors in the later stages. Section 2. Clinical manifestations. Snake strand sore occurs most commonly in the spring and autumn and is more common in adults. At the onset of an outbreak, the skin lesions manifest as a band of red maculopapular eruptions, clusters of vesicles ranging from the size of a grain of millet to a soybean. The vesicles may manifest on one or several parts of the body and usually spread in a band-like pattern. The skin between the blisters can remain unaffected. In patients with mild cases, vesicles may not appear. These patients may instead experience sharp pain or tidal reddening of the area. Skin lesions commonly manifest in the lumbar and costal parts, the chest, or the head and face. They usually follow the cutaneous nerve on one side of the body. The band of vesicles does not generally cross the median line. If the outbreak occurs on the head and face, especially in the region of the eyes and ears, the pain will be more severe and may be accompanied by swelling and pain of the lymph nodes. In severe cases, it may affect the vision and hearing. Pain tends to be more severe in older or more deficient patients and will often extend beyond the area of the lesions. Such patients may continue to suffer from localized pain for months or even years after the lesions have subsided. Section 3. Pattern differentiation and treatment. 1. Body acupuncture. Pattern 1. Effulgent liver gallbladder fire. Primary symptoms. Pathological changes often manifest on the chest and flank. Eruptions may include papules, erythema, and vesicles, accompanied by a burning sensation. The tongue will be red with a yellow fur, and the pulse will be string-like and rapid. Treatment principle. Clear liver and drain fire with assistance by transforming dampness. Point prescription. Bladder 18, bladder 19, liver 14, gallbladder 24, gallbladder 34, and liver 2 all on the affected side. Osher points. Add large intestine 11 and triple burner 5 for fever. Add stomach 36 for poor appetite. Explanation of points. Bladder 18 and bladder 19 clear liver and gallbladder damp heat. Liver 14 is the alarm point of the liver. Gallbladder 24 is the alarm point of the gallbladder. The combination of these alarm points can course and drain damp heat, regulate T, and relieve pain. Gallbladder 34 can benefit the liver and gallbladder and clear damp heat. Liver 2 can clear liver fire and core stagnant T. The combination of large intestine 11 and triple burner 5 harmonizes the stomach and transforms damp. Peripheral needling can clear localized damp heat. Point location and needling. Bladder 18 and bladder 19 are found below the 9th and the 10th thoracic vertebral bodies respectively. With the patient on their back, locate liver 14 from the midline of the clavicular down to the 6th intercostal space. Gallbladder 24 is located 1.5 twin below liver 14 in the 7th intercostal space. Needle obliquely 0.5 to 0.8 twin. Gallbladder 34 is located in the depression anterior and inferior to the capitulum fibulae. Needle perpendicularly or obliquely 1 to 1.5 twin. Liver 2 lies on the dorsum of the foot proximal to the margin of the web between the first and second toes. Needle perpendicularly 0.5 to 0.8 twin. Needle large intestine 11, triple burner 5, and stomach 36 perpendicularly 0.8 to 1.2 twin. Retain the needles for 25 to 30 minutes or use electroacupuncture for 15 minutes. Needling the periphery refers to a subcutaneous needling 1 to 2 centimeters around the affected area with the needles pointing in the direction of the site. In severe cases, or when the vesicles are particularly large, lancing the vesicles is an option. Another option is to bleed the area around the vesicles. Needle once daily in the initial stages of the disease. Needle once every other day thereafter. 10 treatments equal 1 course of treatment. Pattern 2. Spleen and stomach damp heat. Primary presentation. The disease often manifests on the abdomen and the medial aspect of the legs. The vesicles are numerous and large. Fluid in the vesicles is usually turbid with bloody or viscous exudate. A burning pain and an itching sensation are commonly felt on the skin surrounding the sores. General symptoms include a bitter taste in the mouth and dry bound stool or sloppy diarrhea. The tongue is usually red with a yellow greasy coat, while the pulse is likely to be either rapid and slippery or rapid and soggy. Treatment principle. Regulate and harmonize the spleen and stomach. Clear heat and transform dampness. Point prescription. Use peripheral needling around REN 12, spleen 9, stomach 44, stomach 25, and stomach 37 on the affected side. Add triple burner 6 and bladder 25 for patients with dry bound stool. Add large intestine 11 and large intestine 4 for patients with burning pain and itching. Explanation of points. REN 12 is the alarm point of the stomach. Spleen 9 is the Hua-C point of the spleen channel. Stomach 37 is the lower Hua-C of the large intestine. The combination of the 3 points disperses the accumulated Yangming heat. Peripheral needling aims to quicken the blood circulation and clear damp heat. Triple burner 6 and bladder 25 loosen the stools and disperse distension and fullness. Large intestine 11 and large intestine 4 transform the evil heat in the Yangming channel. Point location and needling. REN 12 is located 4 twin above the umbilicus on the anterior midline halfway between the xiphoid process and the navel. Locate the point while the patient is in the supine position. Needle perpendicularly 0.5 to 1 twin. Spleen 9 is located in the indentation posterior-lateral to the border of the medial condyle of the tibia. Needle 0.5 to 0.8 twin. Stomach 44 lies between the second and third toes in front of the second metatarsal joint. Needle perpendicularly or obliquely 0.3 to 0.5 twin. Locate stomach 25 with the patient supine. The point is located 2 twin lateral to the umbilicus. Needle perpendicularly 0.8 to 1.2 twin. Locate stomach 37 with the patient lying or sitting. The point is 6 twin below stomach 35 at the midpoint between stomach 36 and stomach 39. Needle perpendicularly 0.5 to 1.2 twin. Needle triple burner 6, bladder 25, and large intestine 11 perpendicularly 0.5 to 1 twin. Needle large intestine 4 perpendicularly 0.5 to 0.8 twin. Use the methods discussed earlier when doing peripheral needling. Pattern 3. T stagnation and blood stasis. The primary presentation is pain that persists after lesions have cleared, insomnia, a dark purplish tongue with white fur and a string-like pulse. Treatment principle: quicken the blood and dispel stasis, and move T and relieve pain. Points prescription: large intestine 11, large intestine 4, spleen 6, spleen 10, and bladder 17. Explanation of points: large intestine 11 and large intestine 4 clear heat and regulate T. Spleen 6, spleen 10, and bladder 17 quicken the blood and relieve pain. Point location and needling: when the elbow is flexed, large intestine 11 is found in the depression on the lateral end of the cubical crease. Needle 0.8 to 1.2 Swin. Large intestine 4 lies on the dorsum of the hand between the first and the second metacarpal bones. Needle perpendicularly 0.5 to 1 Swin. Spleen 6 is located 3 Swin directly above the tip of the medial malleolus, posterior to the medial border of the tibia. Needle perpendicularly 0.5 to 1.2 Swin. Spleen 10 is located with the knee bent and lies 2 Swin above the medial-superior border of the patella, on the bulge of the medial portion of the muscles quadriceps femoris. Needle perpendicularly 0.8 to 1 Swin. Bladder 17 is located 1.5 Swin lateral to the du at the level of the 7th spinous process. Needle obliquely 0.8 Swin. 2. Ear needling. Select the ear points: liver, gallbladder, lung, stomach, and shenmen. Method: needle the ear to the depth of the cartilage. Stimulate strongly by twisting for about 1 minute. Retain the needles for 30 minutes. 3. Plum blossom needle. The plum blossom needle should be used once the herpes scabs have begun to fall off and all that remains is neuralgia and a localized sensation of tightness in the skin. Use the plum blossom needle to tap on the painful and tight areas until they turn red or bleed slightly. Immediately follow with cupping. Treat 1 to 3 times a week according to the severity of the outbreak. In addition, tap about 1 centimeter distance around the basal root ganglia of the associated spinal nerve and the area around the outbreak 3 to 5 times. Tap other affected areas once daily until they bleed. Section 4. Precautions. 1. According to Chinese medicine, most cases of herpes zoster belong to excess patterns and damp heat patterns. Acupuncture therapy can help shorten the course of the disease, promoting early recovery. Effects are particularly apparent in treating neuralgia and tight sensations of the skin. 2. Excessive consumption of fatty foods, sweet foods, and seafood is forbidden. It is advisable to eat light foods and vegetables and fruits. White patch wind. White patch wind refers to a localized loss of pigment in the skin, resulting in white patches of various sizes and morphology. In biomedicine, white patch wind is equivalent to vitiligo. Section 1. Etiology and pathomechanisms. Disharmony of T in blood with stasis and obstruction of the channels and collaterals is always at the root of white patch wind. The effects of emotional and mental immoderation, disruption of the T dynamic, and repeated contraction of wind evil all affect the skin. If those with constitutional liver and kidney weakness or those who have collapsed essence and blood loss are invaded by an external evil, it will stagnate in the skin. Also, wind damp may affect the skin. Section 2. Clinical manifestations. The affected skin presents with white or milky white patches which are clearly demarcated and which gradually expand in size. There is often an increase in the pigmentation on the periphery. The hair within the affected area may also turn white. Vitiligo is an acquired disorder that can develop at any age and appears on various parts of the body. The patches may arise on one side of the body or both and may even form a belt-like pattern along nerve channels. The skin within the patches is smooth without any scaling or wrinkling. Section 3. Pattern differentiation and treatment. 1. Body acupuncture. Pattern 1. Wind evil assailing the exterior. The primary presentation is white patch wind may attack the head or it may affect the entire body. Onset and development are rapid. White patch wind occurs most often in the young and middle-aged. The tongue fur is thin and white and the pulse is floating or string-like. Treatment principle: dispel wind and moisten dryness. Point prescription: bladder 12, gallbladder 20, dew 14, large intestine 11, kidney 3, spleen 9, and Usher points. Explanation of points. Bladder 12, gallbladder 20, and dew 14 are all key points in treating wind disorders and all have the function of clearing heat. Large intestine 11 is the Huasi point of the Han-Yang-Ming channel and has a strong ability to clear heat. Kidney 3 is the source point of the kidney channel. Spleen 9 is the Huasi point of the spleen channel. The combination of these 2 points has the ability to nourish yin. Combining these points will help to dispel wind and moisten dryness. Point location and needling. Gallbladder 20 is located below the occiput in the depression between the origins of the sternocleidomastoid and trapezius muscles, level with dew 16. Needle 0.5 to 0.8 cun toward the tip of the nose. Bladder 12 is located 1.5 cun lateral to the lower border of the spinous process of the second thoracic vertebra. Needle obliquely 0.5 to 0.8 cun. Dew 14 is located on the midline at the base of the neck in the depression below the spinous process of the 7th cervical vertebra. Needle 0.5 to 1 cun. Kidney 3 is found in the depression between the medial malleolus and the Achilles tendon, level with the prominence of the medial malleolus. Needle 0.5 to 0.8 cun. Spleen 6 is located on the medial side of the lower leg in the depression of the angle formed by the medial condyle of the tibia and the posterior border of the tibia. Needle 0.5 to 0.8 cun. Peripheral needling can also be used around the patches. Pattern 2. Damp heat congestion. Primary symptoms. When damp heat is a primary factor, the patches tend to be more pink and appear mostly on the face or on the base of the neck. The patches grow more rapidly during the summer and autumn and less rapidly in the winter and spring. Heat or sunburn will cause the area to itch severely. Treatment principle: clear heat and expel damp. Point prescription: large intestine 4, stomach 36, stomach 25, stomach 40, spleen 8, and Usher points. Explanation of points. Large intestine 4 is the source point of the Han-Yang-Ming and can clear heat and remove dampness. Stomach 36 is the lower Huasi point of the stomach channel. Its functions include promoting digestion and nourishing the skin and muscles. Stomach 25 is the alarm point of the large intestine and has the function of coursing the central burner. Stomach 40 is a vital point for transforming phlegm. Spleen 8 is the C-cleft point of the spleen channel and has a strong ability to expel damp. The combination of these 5 points can clear heat and expel damp. Stomach 36 is 3 cun below stomach 35, 1 finger breadth lateral to the anterior crest of the tibia. Locate the point with the knee flexed or in a prone position. Needle the point perpendicularly 0.5 to 1.5 cun. Stomach 40 is located 1 finger breadth lateral to stomach 38 at the midpoint between stomach 35 and the lateral malleolus. Needle perpendicularly 0.5 to 1.2 cun. Spleen 8 is 3 cun below spleen 9 on the line connecting spleen 9 and spleen 6. Needle perpendicularly 0.5 to 0.8 cun. Peripheral needling can be used locally. Pattern 3. Liver depression and T stagnation. White patches that are usually pale red and limited to one area of the body. The size of patches can be affected by emotional health and may expand in size and affect the entire body. It most often afflicts females and in such cases may affect menstruation with bilateral distension of the flank and a string-like pulse. Treatment principle: Course the liver and resolve stagnation. Point prescription. Liver 14, Ren 17, liver 3, bladder 13, and Usher point. Explanation of points. Liver 14 is the alarm point of the liver. It loosens the chest and regulates T and relieves liver stagnation. Ren 17 is the meeting point of T and functions to course and regulates the movement of T. Liver 3 is the source point of the liver channel and is able to course the liver and resolve depression of liver T. Bladder 13 is the back shrew point of the lung. It regulates the surface, and as the back shrew point of the zang of the metal element, it also controls the liver wood. Point location and needling. Ren 17 lies on the midline of the sternum at the level of the fourth intercostal space where it meets the sternum. Locate the point with the patient supine. Insert the needle transversely downward 0.3 to 0.5 twin. Liver 3 is found on the dorsum of the foot in the hollow distal to the junction of the first and second metatarsal bones. Needle perpendicularly 0.5 to 0.8 twin. Bladder 13 is 1.5 twin lateral to the du, level with the spinous process of the third thoracic vertebra. Insert the needle 0.5 twin towards the direction of the backbone. Peripheral needling can be used locally. Pattern 4. Liver and kidney insufficiency. The primary presentation is white patch disease is most commonly inherited, but occasionally develops spontaneously. The edges of the patches are clear and distinct. Whitening of the body hair is common. The tongue is usually pale and the pulse thready. Treatment principle. Supplement the liver and kidney. Point prescription. Bladder 18, bladder 23, bladder 20, spleen 6, and Usher points. Explanation of points. Bladder 18, bladder 23, and bladder 20 are the back shrew points that regulate and supplement the liver, supplement the kidney, and fortify the spleen respectively. In combination, they benefit the T and blood and strengthen the source T to nourish the liver and kidney. Spleen 6 is the crossing point of the three yin channels of the foot and can regulate and supplement the liver, spleen, and kidney. Point location and needling. Bladder 23 is located below the spinous process of the second lumbar vertebra, 1.5 twin lateral to the midline. Needle perpendicularly 0.5 to 0.8 twin. Bladder 20 is located 1.5 twin lateral to the lower border of the spinous process of the 11th vertebra. Needle perpendicularly 0.8 to 1 twin. Locate and needle spleen 6 as mentioned above. Peripheral needling can be used around spleen 6. 2. Ear needling. Select lung, occiput, endocrine, and adrenal gland ear points. Also needle the area of the ear that corresponds to the part of the body where the white patch has manifested. On one ear, locate 2 to 3 points in which to embed needles. Alternate with the other ear once a week. 3. Plum blossom needle. Choose an area within the white patch to needle. Method. Use the plum blossom needle to tap the area until it begins to bleed slightly. This can help prevent the patch from expanding. Treat once every 2 days. These locations and techniques are suitable for patterns of wind evil assailing the exterior and are usually used on the face and forehead. Plum blossom needling can also be combined with externally applied herbs. Section 4. Precautions. 1. Acupuncture and moxibustion provide definite results, but even better results can be achieved when combined with the external use of herbs. 2. Patients sensitive to the sun should avoid direct sunlight. 3. Avoid eating spicy or greasy foods. Acne. Acne is a common skin condition characterized by pimples on the face, chest, and back. Acne is caused by interactions between hormones, skin oils, and bacteria that result in inflammation of hair follicles. Section 1. Disease causes and pathomechanisms. The causes of acne include a constitutional abnormal exuberance of yang heat accumulating in the lung channel, combined with repeated contraction of wind evils, which then swelter up to the face, or excessive consumption of spicy, oily, or sweet foods that help promote the formation of damp and its transformation into heat. Insufficient spleen tea causes irregularity of transformation and pooling of damp and turbidity. Chronic stagnation transforms into heat, which scorches the fluids, becoming phlegm and stagnating in the skin. Section 2. Clinical manifestations. Acne most commonly appears on the face, neck, chest, back, and buttocks. It mainly occurs during puberty. It periodically worsens and improves, sometimes intensifying with improper diet or before menstruation. Skin lesions are papules the size of a pinhead that form in a hair follicle and produce whitehead acne or comedones. White or yellow pus plugs may be extruded, and lesions may become infected and inflamed. After healing, there may be temporary darkening of the skin or slight pitting and scarring. Severe acne involves deeper infections, forming purplish to red nodules, abscesses or cysts, which may break and form severe scars or tangerine peel-like skin. Acne is commonly accompanied by seborrhea, and the skin may feel itchy or painful when inflamed. The duration of acne may be long or short, but full recovery is common after adolescence. Section 3. Pattern differentiation and treatment. 1. Body acupuncture. Pattern 1. Lung channel blood heat. The primary symptoms are tidal reddening of the face, acne that protrudes above the surface of the skin and appears primarily on the forehead and beside the nose, a burning itching sensation, pustules or nodules, a red tongue with yellow fur, and a rapid pulse. Treatment principle. Diffuse the lung tea, clear heat, and cool the blood. Point prescription. Bladder 13, bladder 17, lung 5, large intestine 20, and DO 23. Explanation of points. Bladder 13 can diffuse the lung tea and clear heat. Bladder 17 is the meeting point of the blood and has the action of clearing heat and cooling the blood. Lung 5 is the He point of the lung channel and can clear evil heat from its channel. Large intestine 4 can clear blood heat from the head and the face. Taiyang, large intestine 20, and DO 23 can remove the channel T, helping to clear heat and cool the blood. Point location and needling. Locate bladder 13 and bladder 17 as mentioned above. With the elbow bent, locate lung 5 on the cubical crease of the elbow and the depression of the radioside of the tendon of biceps brachii. Needle perpendicularly 0.5 to 0.8 Swin. Large intestine 20 is located in nasolabial groove at the level of the midpoint of the lateral border of the ala nasi. Needle perpendicularly 0.1 to 0.2 Swin or obliquely 0.3 to 0.5 Swin. Taiyang is located in the tender depression on the temple of the head. DO 23 is located 1 Swin posterior to the anterior hairline on the midline of the head. Needle obliquely 0.3 to 0.8 Swin. You can also bleed a bean-sized drop of blood from the point. Treat every other day. One course of treatment is 10 days. Pattern 2. Stomach and intestine damp heat. Primary symptoms. Pustular or nodular acne distributed primarily on the forehead or cheeks that is red, swollen, and painful, increased oily skin secretions, dry bound stool, scant and painful urination, a red tongue with yellow greasy fur, and a slippery rapid pulse. Treatment principle. Clear the stomach and intestines and transform damp heat. Point prescription. Stomach 6, bladder 2, large intestine 11, large intestine 4, stomach 36, and stomach 44. Add Ren 12 and stomach 25 for those with abdominal distension and anorexia. Add triple burner 6 and stomach 25 for those with dry bound stool. Explanation of points. Stomach 6 and bladder 2 clear damp heat in the head and face. Large intestine 4 and large intestine 11 can clear the evil heat from the Yangming channel. Stomach 36 and stomach 44 can harmonize the stomach and transform heat. Ren 12 is the alarm point of the stomach, and stomach 25 is the alarm point of the large intestine. The combination of the 2 points function to harmonize and regulate the stomach and intestines, as well as disperse accumulations. The combination of triple burner 6 and stomach 25 has the ability to remove food stagnation and loosen stool. Point location and needling. Locate large intestine 11, large intestine 4, stomach 36, and stomach 44 as mentioned above. Locate bladder 2 superior to the inner canthus in the depression on the eyebrow close to its medial end. Needle horizontally 0.3 to 0.8 swin. Stomach 6 is located approximately 1 finger breadth anterior and superior to the angle of the jaw at the prominence of the masseter muscle. Needle 0.5 to 1 swin obliquely towards the direction of stomach 4. 2. Ear needling. Select the following ear points: endocrine, sympathetic, lung, shen men, adrenal gland, forehead, and large intestine. Needle as before, or apply Wang Bu Liu Xing seeds. 3. Plum blossom needle. Select the points DU 14, bladder 13, large intestine 11, and spleen 10. Method. First tap with a plum blossom needle until the skin turns red or bleeds slightly. Follow with cupping of the area for 5 to 10 minutes. Treat twice per week. Section 4. Precautions. 1. Acne is a common skin disorder among young men and women. There is a definite correlation between acne and the endocrine and digestive systems. Acupuncture can improve physiological functioning, thus reducing reoccurrence and facilitating recovery. 2. Wash the face regularly with warm water and sulfur soap. 3. Avoid eating spicy and stimulating foods. Reduce consumption of oily and sweet foods. Eat more fresh vegetables and fruits. Maintain healthy bowel movements. 4. Avoiding popping the pimples will prevent further inflammation and scarring. White crust disease, also known as psoriasis. White crust disease is so called because the skin looks scabby, is white in color, and itchy. Scratching produces white skin. It is a common inflammatory disorder that often resolves and recurs. It is also referred to as pine bark lichen, dry lichen, snake lice, and white shell sore. It corresponds to psoriasis in biomedicine. Section 1. Etiology and pathomechanisms. 1. Invasion by wind cold leads to disharmony of the construction T and defensive T. 2. Wind heat invades the pores and creates stagnation, eventually leading to blood dryness. 3. Disharmony of the thoroughfare and controlling vessels with exhaustion of blood leads to blood deficiency and produces wind and dryness. Section 2. Clinical manifestations. Psoriasis occurs mostly in young adults, males more than females, and there is a genetic predisposition. The disease commonly manifests or is aggravated in winter and improves in summer. After many years, the influences of seasonal changes are not so obvious. According to the clinical characteristics of psoriasis, it is divided into common, pustular, arthritic, and erythrodermic types. 1. Psoriasis vulgaris. Psoriasis vulgaris begins as small papules that enlarge to become pale red or bright red papules and maculopapules the size of mung beans or soybeans. The eruptions may fuse and form lesions of varying forms that have clearly demarcated borders and are covered by dry white scales. Scraping away of the scales reveals a shiny translucent membrane. If the translucent membrane is scraped away, the area may begin to bleed. When eruptions appear on the head, the hair will grow in fascicles, but the hair itself will be normal and will not fall out. Psoriasis on the fingernails causes them to pit and thicken. Psoriasis on a mucous membrane, such as the mouth, will cause a gray lesion with a red circumference and an infiltrated base. Manifesting on the glans penis, the lesion will be a smooth, sharply demarcated, dry erythema. Scales are produced when the lesion is scraped. Skin lesions are distributed symmetrically and may manifest on any part of the body. However, they primarily occur on the scalp, elbow joint, and knee joints. The lesions may be guttiform, coin-shaped, plaque-like, map-shaped, conch-shaped, or of mixed shapes. Onset is usually gradual, with chronic remission and reoccurrence being common. Psoriasis is usually aggravated in winter and improves in summer, but a minority of conditions are aggravated in the summer. The course of the disease is divided into 3 stages. A. Active stage. During the active stage, new papules will begin to manifest and continue to develop and grow in size. In time, the lesions become bright red and are covered by shiny scales. Needling, friction, or external trauma may produce new lesions. This is called Koebner's phenomenon. B. Resting stage. During the resting stage, the condition of the lesion stabilizes and no new plaques are produced. The original plaque turns dark red, scales diminish, and the size of the plaque stabilizes. C. Regressive stage. During the regressive stage, the size of the lesions shrink, become lighter in color, and the scales diminish. Some lesions will begin to recede from the center, leaving a temporarily depigmented or hyperpigmented spot. 2. Pustular psoriasis. Pustular psoriasis is less common and is divided into universal pustular type and palmar and plantar pustular types. In the initial stages of universal pustular type psoriasis, most lesions present as inflammatory erythemas or manifest on top of psoriasis vulgaris as superficial coarctate yellowish-white pustules with a light covering of scales. These pustules disappear in about 2 weeks, followed by new pustules. In severe cases, onset is acute, with concentrations of pustules appearing over the entire body, which then converge together. Symptoms are accompanied by fever, swollen, painful joints, and general malaise. In palmar and plantar pustular type psoriasis, symmetrical erythema on the palmar and plantar surfaces manifests with concentrated pustules from the size of a needle tip to millet grain. Three. Arthritic psoriasis. Arthritic psoriasis is seldom seen in the clinic. In addition to psoriasis, there will be joint soreness, distension and swelling, limited joint mobility, and even deformation. The distal joints of the fingers and toes are commonly affected. In severe conditions, the large joints of the body may also be affected. 4. Erythrodermic psoriasis. Erythrodermic type psoriasis is a further development of psoriasis vulgaris and can be caused by the improper treatment of psoriasis, the use of irritating external medications, or the sudden cessation of hormone-based medications. Its symptoms include diffuse reddening, generalized swelling of the skin, intensive scaling of the skin, keratinization of the plantar and palmar surfaces, and nails which may thicken or fall off. General symptoms include feverishness, aversion to cold, and mild swelling of the lymph glands. Section 3. Pattern differentiation and treatment. Pattern 1. Accumulation of blood heat in the interior. Primary symptoms include rapid onset, guttiform lesions, a bright red complexion, multiple layers of scales, severe pruritus, and mild bleeding upon scratching. The tongue is red with a thin yellow fur. The pulse is string-like and slippery or rapid. Treatment method: clear heat, cool blood, resolve toxins, and disperse macules. Pattern 2. Wind dryness due to blood deficiency. This pattern has a much longer disease course. Primary symptoms include patch-type lesions, a light red complexion, and less scaling. Skin is dry and cracked with pruritus. The tongue is red with scant fur. The pulse is deep and fine. Treatment principle: nourish blood in yin, moisten the skin and extinguish wind. Pattern 3. T stagnation and blood stasis. In this pattern, the typical course is one of chronic remissions and recurrences. Primary symptoms include plaque-type lesions, thicker scales, and a dusky red complexion. The tongue is dusky purple with stasis spots, while the pulse is rough or fine and moderate. Treatment principle: quicken the blood and transform stasis, resolve toxins and free the collaterals. Pattern 4. Obstruction due to the accumulation of damp evil. Primary symptoms are red, eroding lesions that are thick, sticky, and covered with a crust. Lesions appear most commonly in the axillary fossa, the groin, and other folds of the body. Other possible manifestations are red macules, pustules, and scaling on the plantar and palmar surfaces. The tongue is red with yellow greasy fur and the pulse is slippery. Treatment principle: clear heat and disinhibit dampness, resolve toxins, and free the collaterals. Pattern 5. Intense fire toxicity. Primary symptoms: tidal reddening of the entire surface of the body, burning sensation, pruritus, and pain, coupled with severe flaking, scaling, or concentrations of small pustules. The tongue is crimson with a yellow greasy fur and a string-like slippery and rapid pulse. Treatment principle: clear heat and resolve toxins, nourish the blood and harmonize the construction T. 1. Body acupuncture. Point prescription. Huatuo's paravertebral points, large intestine 11, spleen 10, du 14, spleen 6, bladder 17, large intestine 4, spleen 9, bladder 11, and the 12 well points. Explanation of points. Huatuo's paravertebral points connect to the Du channel and share the same source as the Chong and Ren channels. In addition, the points link to the bladder channel and unite with the kidney channel. Needling these points regulates yin and yang, harmonizes the qi in blood, and moistens the skin. Large intestine 11 clears heat and resolves toxins. Spleen 10 courses wind and quickens the blood. Du 14 purges heat and resolves toxic evils. Pricking the top of the ear cools the blood. Bladder 17 is the meeting point of the blood. In combination with spleen 6, it can help nourish the blood and extinguish wind. Large intestine 4 expels wind and clears heat. Spleen 9 disinhibits dampness and disperses swelling. The 12 well points clear heat and cool blood. Bladder 11 is the meeting point of the bone. Combined with local points on and around swollen joints, it can expel wind, disinhibit dampness, relieve B syndrome, and loosen the joints. Point location and needling. Bladder 11 is 1.5 cun lateral to the Du channel, level with the spinous process of the first thoracic vertebra. Needle obliquely 0.5 to 0.8 cun. Prick and bleed each of the 12 well points. The 12 well points are lung 11, large intestine 1, pericardium 9, triple burner 1, small intestine 1, heart 9, spleen 1, liver 1, stomach 45, gallbladder 44, bladder 67, and kidney 1. Huatuo's paravertebral's acupuncture method. Needle along both sides of the spine, alternating between the left and right sides. Needle perpendicularly 0.5 to 1 cun with a neutral reinforcing and reducing technique. Locate large intestine 11, spleen 10, and Du 14 as previously mentioned. Use a 3-edged needle to prick and bleed 3 to 5 spots around these points, then follow with cupping. For a pattern with accumulation of heat in the interior, bleed 3 to 5 drops of blood from the tip of the ear. For a pattern with blood deficiency and wind dryness, add spleen 6 and bladder 17. For patterns with T and blood stasis, add large intestine 11, spleen 10, large intestine 4, and spleen 9. 2. Ear needling. Select the following ear points: lung, shenmen, endocrine, heart, and large intestine. Embed needles in the ear points or attach ear seeds. 3. Plum blossom needle. Plum blossom needles are suitable for the pattern of blood deficiency and wind dryness and can stand alone as a treatment method. Locate 3 lines, 0.5 cun, 1.5 cun, and 3 cun lateral to the Du channel at the level of the lesions. Tap each of the 3 lines. Repeat 3 times. For severe localized skin lesions, tap until there is slight bleeding. Treat once per day. 4. Bleeding and cupping. Locate the following points: Du 14, Du 13, bladder 18, and bladder 20. Method. Locate 1 or 2 points each day and bleed them with a 3-edged needle. Follow by cupping each point, leaving the cup for 5 to 10 minutes. Repeat this once every other day. One course of treatment lasts 10 days. Section 4. Precautions. 1. Better effects can be achieved when combined with Chinese herbs. 2. Avoid eating spicy foods and foods that may be allergenic, such as shellfish. 3. Do not smoke or drink alcohol. 4. Eat more vegetables and fruits. 5. Avoid stimulating medicinals during the acute stages or with erythrodermic type psoriasis. 6. Avoid taking hot baths or showers. Damp sores. Damp sores are allergic inflammatory type skin disorders equivalent to eczema in biomedicine. Some names given in Chinese medicine for various disorders, such as wet spreading sore, blood wind sore, or millet sore, are based on the differences in lesions and appearances. Some names are based on where the disorder manifests, such as ear turning sore, kidney sac wind, umbilical sore, forebends wind, and nipple wind. Section 1. Etiology and pathomechanisms. The causes of damp sores include constitutional weakness and dietary irregularities. Other factors include injury to the spleen and stomach, which leads to the production of damp heat. Externally contracted wind evil then contends with the damp heat and together invade the skin. After time, the yin and blood become exhausted, leading to blood deficiency and wind dryness. This disorder is connected to pathological changes of the heart, lung, liver, and spleen channels. Section 2. Clinical manifestations. 1. Acute damp sores. This disease corresponds to acute eczema in biomedicine. Symptoms include a rapid onset with symmetrical, primary, or pleomorphic lesions. Also included is erythema and tidal reddening, papules, papulovesicles, blisters, pustules, exudation, and scabbing. It may occur on any part of the body or spread to the entire body. However, it is most often seen on the head, face, behind the ears, on the hands or feet, scrotum, vulva, or anus. It is usually distributed symmetrically. Common pathological changes include lamellation or diffusion of the lesions with no clear demarcation. Skin lesions are multiple concentrations of millet-sized papules or papulovesicles with an erythemic base. Scratching of the lesion will cause the center of the lesion to worsen and lead to exudation, erosion, and scabbing, while at the periphery, scattered papules, erythemas, and vesicles develop, creating an unclear boundary. If the disorder does not become chronic, the crust will abate after 1 to 2 months and the lesions will disappear. Intensive scratching, washing with soap and very hot water, consumption of alcohol, and the eating of spicy, stimulating, or allergenic foods may cause lesions to worsen or pruritus to intensify and may affect sleep. Lesions that become infected due to scratching commonly begin to erode, exude fluids, suppurate, and may even form furuncles or tubercules. 2. Subacute damp sores. Subacute damp sores correspond to subacute eczema in biomedicine. They develop from the failure to treat acute damp sores in a timely manner, inappropriate treatment, or a drawn-out disease course. Subacute damp sores occasionally manifest without a history of acute sores. Lesions are not as severe as those in the acute type, with papules, crusting, and scales being the primary manifestations. A few vesicles or some erosion may be present. 3. Chronic damp sores. Chronic damp sores correspond to chronic eczema in biomedicine and evolve from inappropriate treatment, a protracted condition, or recurrent attacks. Some patients initially develop symptoms of chronic damp sores. Skin lesions tend to be confined to specific parts of the body, such as the calves, hands, feet, cubital fossa, popliteal fossa, vulva, or anus. Clinical manifestations include dusky red or purple-brown skin that is thickened and rough, with obvious striations or lichenification. There may be scales, scars, scabs, or hyperpigmentation on the surface of the lesions if they have been scratched. Some lesions may erupt with new papules. If scratched, they will exude pus. Lesions on the hands, feet, and joint areas are often chapped and painful, affecting physical activity. Patients who suffer from pruritus will often have paroxysmal episodes, often in the middle of the night or after episodes of mental stress, drinking, or consumption of spicy and allergenic foods. The pruritus may intensify. Recurrent attacks are common with symptoms remitting and worsening over an extended period of time. Section 3. Pattern differentiation and treatment. 1. Body acupuncture. Pattern 1. Accumulation of damp heat in the skin. Primary symptoms include rapid onset with a short disease course, reddish lesions, papulovesicles, and continual burning and itching sensations. Viscous water fluid flows out of the sores when they are scratched. The tongue is normal with thin white or yellow fur and a slippery or rapid pulse. Treatment principle: clear heat and disinhibit dampness. Point prescription: DU14, large intestine 4, spleen 9, liver 5, and stomach 40. Explanation of points. DU14 is the meeting point of the young channels and is able to purge heat. Large intestine 4 is the primary point of the large intestine channel and has the function of coursing wind and clearing heat. Spleen 9 is the Huasi point of the spleen and is able to fortify movement and transformation, as well as disinhibit dampness. Liver 5 is the Luo point of the liver, and stomach 40 is the Luo point of the stomach. The combination of the 2 points can course the channels and collaterals and expel damp turbidity. The combination of these 5 points is used to clear heat and disinhibit dampness. Point location and needling. Locate DU 14, large intestine 4, and spleen 9 as before. Liver 5 lies 5 twin above the prominence of the medial malleolus, immediately posterior to the medial crest of the tibia. Stomach 40 is 1 finger breadth lateral to stomach 38 at the midpoint between stomach 35 and the lateral malleolus. Needle perpendicularly 1 twin. Pattern 2. Spleen deficiency and damp accumulation. Primary symptoms include gradual onset, pruritus, and reddish lesions with papulovesicles, as well as lesions that are covered with scales and tend to erode and exude fluid if scratched. The tongue will be pale and plump with a white greasy fur, and there will be a string-like moderate pulse. Treatment principles: clear heat, dry dampness, and fortify the spleen. Points prescription. Add bladder 20 and bladder 21 to the above prescription. Explanation of points. Adding these back transport points to the above prescription will help to free the T of the organs and regulate the T of the spleen and stomach while collectively functioning to clear heat, dry dampness, and fortify the spleen. Point location and needling. Locate and needle bladder 20 and bladder 21 as before. Pattern 3. Blood deficiency and wind dryness. The primary symptoms of this pattern are a long disease course, recurrent attacks and lesions that are thick, rough, and dark, or hyperpigmented. In addition, there may be unbearable pruritus that is aggravated by heat, mental stress, alcohol, and pungent spicy foods, or foods that are allergenic. The tone will be pale and the pulse is stringy and thready. Treatment principles: nourish blood and moisten dryness. Point prescription: large intestine 11, spleen 10, bladder 17, and spleen 6. Add heart 7 and bladder 15 if there is severe itching late at night. Explanation of points. Large intestine 11 is the Huasi point of the large intestine channel, and in combination with spleen 10 can course wind and invigorate blood. Bladder 17 is the meeting point of blood and is able to nourish blood and moisten dryness. Spleen 6 can enrich yin and nourish blood. Heart 7 can pacify the heart and quiet the spirit. Point location and needling. Locate large intestine 11, spleen 10, bladder 17, and spleen 6 as mentioned above. 2. Ear needling. Ear needling is suitable for patients with marked pruritus. Select the ear points: shenmen, lung, heart, liver, endocrine, and subcortex. Method: select 3 to 5 points each treatment. Needle or attach ear seeds every other day. 3. Plum blossom needling is suitable for patients with chronic eczema. Location of points. Choose points lateral to the spine as well as adjacent to the lesions. Method: tap beside the vertebrae until the skin turns red. Tap around the lesions until they bleed slightly. Tap gallbladder 20 and Sishin Hong for those with insomnia due to pruritus. Section 4. Precautions. 1. The causes and clinical manifestations of eczema are numerous and are mainly due to delayed allergic reactions. Acupuncture has a definite effect on improving the body's immune system and thus helps to reduce allergic reactions. 2. Avoid washing with soap or hot water during the acute stages. Avoid scratching to prevent infection. 3. Do not eat pungent and spicy foods, seafood, chicken, goose, beef, mutton, and foods that may be allergenic. Also avoid such pungent and aromatic vegetables such as cilantro, chives, celery, ginger, onion, and garlic. 4. No vaccines should be taken during the acute stages of eczema. Dormant papules. Dormant papules is a dermatological disease which manifests as red or gray wheals on the skin, pruritus, and allergic reactions. It is similar to urticaria in biomedicine. Section 1. Disease causes and pathomechanisms. Dormant papules are a result of constitutional weakness, which causes the defensive exterior to be weakened and subsequently attacked by wind evil, or by dietary irregularities. Another pathomechanism is emotional immoderation causing disharmony of the Chong and Rim meridians. This leads to liver and kidney insufficiency and blood deficiency, which engenders wind and dryness. Section 2. Clinical manifestations. Dormant papules can occur at any age and any time of year. Their onset is sudden, and lesions may appear anywhere on the body. The lesions are red or white, clearly demarcated wheals. They vary in shape and size and usually disappear rapidly, leaving no scarring. Thereafter, lesions will continue to appear in clusters, then disappear and reappear again. There may or may not be slight itching, numbness, or swelling in the affected area. These symptoms usually subside within a few days, leaving no scarring or permanent damage. There may also be severe pain and itching, as well as a burning sensation. Some patients may experience aversion to cold or feel feverish. If the mucosa of the digestive tract is involved, there may be nausea, vomiting, abdominal pain, or diarrhea. If the upper respiratory tract is involved, there may be edema of the throat, dyspnea, chest oppression, a feeling of suffocating, and even syncope. Dormant papules may be divided into acute and chronic types. Acute attacks can last from a few days to a couple of weeks. Chronic type lesions can come and go for months or even years. Section 3. Pattern differentiation and treatment. 1. Body acupuncture. Pattern 1. Wind-cold pattern. Primary symptoms include white lesions, which feel worse when exposed to wind or cold and better with warmth. They most commonly appear in winter. The tongue coat will be thin and white and may be greasy. The pulse will be slow or rapid and soft. Treatment principle: dispel wind and dissipate cold and harmonize construction and defense. Point prescription. Prescription 1. Gallbladder 20, large intestine 11, spleen 10, bladder 12, and bladder 13. Prescription 2. Stomach 36, bladder 21, bladder 20, and bladder 23. Explanation of points. In prescription 1, gallbladder 20 dispels wind and clears heat. Large intestine 11 and spleen 10 quicken the blood and dispel wind. Bladder 12 and 13 harmonize construction and defense, while spleen 9 can fortify the spleen and disinhibit damp. In prescription 2, stomach 36 combined with bladder 21, 20, and 23 strengthens the yang of the defense qi to defend against wind. This prescription can be modified using points from prescription 1. Point location and needling. Locate the points as mentioned earlier. With the patient supine, locate bladder 12, 1.5 twin lateral to the due meridian below the lower border of the spinal process of the second thoracic vertebra. Needle obliquely 0.5 to 1 twin. Moxa large intestine 11 and spleen 10. Pattern 2. Wind heat pattern. The primary symptoms in wind heat pattern are red wheals that get worse with exposure to heat and better with cold. Manifestation is most common in the summer. The pulse will be floating and rapid, and the tongue fur thin and yellow. Treatment principle: dispel wind and clear heat. Point prescription. Prescription 1. DU 14, large intestine 11, spleen 10, and gallbladder 20. Prescription 2. DU 14, bladder 25, spleen 9, and heart 7. Explanation of points. In prescription 1, use DU 14 to purge heat. Gallbladder 20, large intestine 11, and spleen 10 to coarse wind and clear heat type dormant papules. In prescription 2, needling the back transport points can clear the heat of the 12 channels, while heart 7 stops pruritus and spleen 9 disinhibits damp. Point location and needling. Needle heart 7, 0.3 to 0.5 twin perpendicularly. Bleed in cup DU 14. Needle large intestine 11 and spleen 9 and 10 as previously mentioned. Pattern 3. Allergic pattern. Dormant papules can be induced by eating fish, shrimp, meat, and foods that are considered to incite wind, are drying, or allergenic. Symptoms include a pale tongue with white fur and a deep, thready, moderate pulse. Treatment principles. The treatment principles are to warm the center, fortify the spleen, and harmonize the construction and defense. Point prescription. Stomach 36, spleen 6, Ren 12, pericardium 4, and spleen 2. Explanation of points. Stomach 36, Ren 12, and spleen 6 can fortify the center and nourish the blood, warm the spleen and stomach, and nourish the spleen. Spleen 2 is the spring point of the foot tie-in channel and has the action of clearing heat and removing dampness. Pericardium 4 is the spring point of the hand-Jueyin channel and has the ability to clear the construction T and relieve itching. Method: needle Ren 12, 0.5 to 1 swin perpendicularly and use the supplementation twirling technique on stomach 36 and spleen 6. Needle pericardium 4 perpendicularly, 0.5 to 1 swin, and spleen 2, 0.3 to 0.5 swin. Pattern 4. Disharmony of the Chung and Ren channels. Primary symptoms include lesions that generally appear a few days before menstruation and slowly recede until after menstruation, when they resolve completely. Lesions most commonly appear on the medial area of the legs, as well as the lumbosacral area and lesser abdomen. The tongue will be purple with a thin fur, and the pulse will be string-like and fine. Treatment principle: harmonize the Chung and Ren channels. Point prescription: Ren 4 and 6, bladder 17, pericardium 6, spleen 4 and spleen 8, and stomach 30. Explanation of points: Ren 4 and 6 belong to the Ren channel and connect with the 3 yin channels, combined with the meeting point of the blood. Bladder 17 supplements T, nourishes blood, and harmonizes the Chung and Ren channels. Spleen 4 and pericardium 6 are 2 of the 8 confluence points and can regulate menstruation and rectify T. Spleen 8 is the spring point of the spleen channel and is a point that treats the T of the blood. Stomach 30 is the confluence point of the foot Yangming channel and the Chung channel. The combined effect of these points is to contain and harmonize the Chung and Ren channels. Point location and needling. Locate Ren 4 and Ren 6 and bladder 17 as before. Needle using the twirling and reducing method. Needle spleen 4, 0.5 to 0.8 swim perpendicularly. Spleen 8 is 3 twin below spleen 9 on the line between spleen 9 and spleen 6. Needle it perpendicularly 0.8 to 1 swin. 2. Ear needling. Needle the points lung, spleen, adrenal gland, subcortex, and shenmen. Method: needling or herbal seeds are used in the treatment of dormant papules caused by allergic reactions or disharmony of the Chung and Ren channels. Section 4. Precautions. Acupuncture is particularly effective compared with biomedicine in the treatment of dormant papules and sometimes can achieve miraculous effects. Do not eat seafood or spicy pungent foods, including onions and garlic. Do not drink alcohol. Do not ingest drugs or foods that may cause an allergic reaction. The patient should also avoid contact with objects that could inflame the condition. Conclusion: Chinese medicine contributes greatly to the diagnosis and treatment of dermatological conditions. It is important both to differentiate the pattern according to traditional theory and to utilize biomedical theories to inform Chinese medicine research. This combining of vesicles may manifest on one or several parts of the body and usually spread in a band-like pattern. The skin between the blisters can remain unaffected. In patients with mild cases, vesicles may not appear. These patients may instead experience sharp pain or tidal reddening of the area. Skin lesions commonly manifest in the lumbar and costal parts, the chest, or the head and face. They usually follow the cutaneous nerve on one side of the body. The band of vesicles does not generally cross the median line. If the outbreak occurs on the head and face, especially in the region of the eyes and ears, the pain will be more severe and may be accompanied by swelling and pain of the lymph nodes. In severe cases, it may affect the vision and hearing. Pain tends to be more severe in older or more deficient patients and will often extend beyond the area of the lesions. Such patients may continue to suffer from localized pain for months or even years after the lesions have subsided. Section 3. Pattern differentiation and treatment. 1. Body acupuncture. Pattern 1. Effulgent liver gallbladder fire. Primary symptoms. Pathological changes often manifest on the chest and flank. Eruptions may include The aim of this instructional video is to help both students and practitioners gain a systematic understanding of the theory and treatment of dermatological disorders with acupuncture. In addition to strengthening fundamental acupuncture theory, point location, and needling techniques for the treatment of dermatological diseases. This video contains information that aims to help practitioners understand the laws of pattern differentiation, as well as prevention of common dermatological problems. We will now begin our introduction to the use of acupuncture for the treatment of many commonly seen dermatological problems. Snake strand sore. Snake strand sore is an acute herpetic skin disorder that manifests with clustered eruptions of vesicles on the skin. Most often, these blisters appear on one side of the body. They usually wrap around the trunk and are accompanied by a painful burning sensation. In biomedicine, snake strand sore is referred to as herpes zoster. In Chinese medicine, it is also called girdling fire cinnabar, fire band sores, snake cinnabar, or spider sores, and the 10 thoracic vertebral bodies respectively. With the patient on their back, locate liver 14 from the midline of the clavicular down to the 6th intercostal space. Gallbladder 24 is located 1.5 twin below liver 14 in the 7th intercostal space. Needle obliquely 0.5 to 0.8 twin. Gallbladder 34 is located in the depression anterior and inferior to the capitulum fibulae. Needle perpendicularly or obliquely 1 to 1.5 twin. Liver 2 lies on the dorsum of the foot proximal to the margin of the web between the first and second toes. Needle perpendicularly 0.5 to 0.8 twin. Needle large intestine 11, triple burner 5, and stomach 36 perpendicularly 0.8 to 1.2 twin. Retain the needles for 25 to 30 minutes or use electroacupuncture for 15 minutes. Needling the periphery refers to a subcutaneous needling 1 to 2 centimeters around the affected area, with the needles pointing in the direction of the site. In severe cases, or when the vesicles are particularly large, lancing the vesicles is an option. Another option is to bleed the area around the vesicles. Needle once daily in the initial stages of the disease. Needle once every other day thereafter. Include papules, erythema, and vesicles, accompanied by a burning sensation. The tongue will be red with a yellow fur, and the pulse will be string-like and rapid. Treatment principle: clear liver and drain fire with assistance by transforming dampness. Point prescription: bladder 18, bladder 19, liver 14, gallbladder 24, gallbladder 34, and liver 2, all on the affected side. Osher points: add large intestine 11 and triple burner 5 for fever. Add stomach 36 for poor appetite. Explanation of points: bladder 18 and bladder 19 clear liver and gallbladder damp heat. Liver 14 is the alarm point of the liver. Gallbladder 24 is the alarm point of the gallbladder. The combination of these alarm points can course and drain damp heat, regulate T, and relieve pain. Gallbladder 34 can benefit the liver and gallbladder and clear damp heat. Liver 2 can clear liver fire and course stagnant T. The combination of large intestine 11 and triple burner 5 harmonizes the stomach and transforms damp. Peripheral needling can clear localized damp heat. Point location and needling: bladder 18 and bladder 19 are found below the 9th. Section 1. Disease causes and pathomechanisms. Snake strand sore occurs due to the internal damage caused by emotional and mental immoderation, as well as binding depression of the liver T. Long-standing internal damage and stagnation can transform into fire and spread outward to the skin. Snake strand sore most commonly manifests on the trunk. If the damp evil seeps downward, it may attack the genital region or the legs. In elderly or deficient patients, there is often blood deficiency with liver fire rising and damp heat toxins have accumulated in the body. This leads to the stagnation of T, congealing of blood, and obstruction of the channels and collaterals, which in turn causes intense pain and a protracted illness. In short, damp heat fire toxin is the primary factor in the initial stages of snake strand sore, while deficiency of right T and blood stasis, along with damp evil, are the primary factors in the later stages. Section 2. Clinical manifestations. Snake strand sore occurs most commonly in the spring and autumn and is more common in adults. At the onset of an outbreak, the skin lesions manifest as a band of red maculopapular eruptions, clusters of vesicles ranging from the size of a grain of millet to a soybean.